Prof.
Yeah, I'm here. Sorry.
Hi, Prof. Do you see the timer naman po?
I do in 6 and 50 more minutes.
Yes, okay po.
6 minutes and 50 seconds. Yes. Guys, I have a question. We don't have to consume the entire hour, diba? Well, if we are able to finish it in, say, 40, 45 minutes, it's okay to stop, no?
Yes po, Prof. Pwede naman.
Yeah. I think the attention span isn't going to be longer than 30, 40 minutes. Eh?
All right, Prof. I'm giving the hosting to you.
Yep. The video is already pinned. Okay.
Right, Prof. We are beginning.
I'm not able to control my slides. Okay. Shall I begin now?
Yes, Prof. You may begin.
A pleasant good afternoon to everybody. Welcome to the Asian Institute of Management, the Masters in Masters in Disaster Risk and Crisis Management. I'm privileged today to provide you a short masterclass and a lecture about dealing with disasters and crises, specifically what a leader should be prepared for. We live in very abnormal times, and oftentimes what we have would be different kinds of disaster, ranging from natural disaster, from volcanic eruption to fires to flooding. And these are just real events that has happened recently within the last few months. Not to mention also that we have zoonotic diseases, measles outbreak in Africa, influenza in other parts of the country, including man-made problems such as conflict and wars. Today, we are focused a little bit more on the pandemic, as this is the flavor of the last few months, and discuss how disaster and crisis management can play a big role. What I'd like to position us to understand is where are we right now? Now, disaster is we're going to see disaster day in and day out. But what is more important is how do we protect ourselves and protect our society by understanding how the disaster is managed. How do we live with this kind of uncertainty? Because those who are prepared for it will be in a better chance of bouncing back. And this is the concept of resilience. Now, you can choose you want to be a disaster practitioner out in the field, or this course can help you decide that you can be part of a larger group doing executive functions, meeting with top leaders and advising them on what to do, or work in a command center to coordinate disaster efforts. Now, disaster is not just about response. There are many things that have to be taken into consideration from the disaster management cycle. You have preparation, prepositioning, then the response, recovery, and rehabilitation. Now, this needs leadership. This needs an understanding of coordination, collaboration, and management. And this is what this course is all about, offering you a chance to understand the value chain of these different steps put together. The vision of this program is really to create not just people and practitioners who will go back to their agencies to strengthen their agency's approach to management of disaster or crisis, but in fact create that kind of integrators, an integrator that will align and work with other agencies together in order to create collaboration and synergy and value. And this is what we have put in mind, and this is our vision. Let me ask you a question. Oftentimes, we ask this of our students. Is disaster and a crisis, in your opinion, does it bring out the best or the worst in our behavior? Say in the Philippines, what do we see every day in our normal lives? Do we have a problem? We have a little accident. Do we bring out the best in people? Some say yes, because of this bayanihan, helping each other. But we've also seen the extremes on the other side, where people try to take advantage of everybody else. And this is a very good platform to understand and study human behavior, how we help each other or how we try not to help each other. Now, in terms of understanding this pandemic, and which we consider as our enemy, there is in fact another enemy that we need to process. And in leadership and the understanding of human behavior, we need to understand that we ourselves can also be the enemy. Sun Tzu, his Art of War treatise, both a scholar and a warrior, said the following things: if you know the enemy and know yourself, you need not fear the result of 100 battles. If you know yourself, but not the enemy, and every victory gained, you will also suffer some form of defeat. Now, if you know neither yourself, your strength, your weakness, and the enemy that you're dealing with, you will always lose in every battle. Now, what do we know, in fact, about this current pandemic that we have called SARS coronavirus 2019? Let me take you back in years ago, in 1917 and 1918, we had the Spanish influenza, and it had killed millions of people at the time. And that was the advent where air travel was not even very progressive, and yet it got transmitted to different places around the world. And we saw the beginning of this influenza pandemic hurting, causing damage, affecting economy as well. Not surprisingly, in January 2019, the World Health Organization, in fact, listed down a number of global threats to our health. If you take a look at this, it's almost like a prophecy and prediction of what will happen the year later. Air pollution and climate change has been with us for a long time, and yet we take that for granted. We have non-communicable disease ranging from diabetes, hypertension, heart diseases, and cancer are things that should not be neglected, and that has in fact killed a lot more people over the years. A global influenza pandemic is top 3 here. Antimicrobial resistance, because of people misuse of antibiotics, is going to create mutations and evolution of bacteria and other infectious agents, a high-threat pathogen. If we exist in an environment where our health system is also very weak, primarily the basic healthcare system, that will also have a say in how we will manage pandemics. Vaccine hesitancy has been there for years, and even up to now, there are groups that are maligning the use of vaccine. So let me take you through the next few slides and explain our role as a disaster practitioner and how we exercise leadership. Take a look at this dashboard that came from the Johns Hopkins University. You can see that in many places around the world, the pandemic has spread. And the different confirmed cases of the countries, the number of deaths, who were recovered, what is likely to happen, and how long this will last. This is fairly new to us, and therefore, a lot of information we don't know. We are using best science and knowledge and influencing policy and judgment. Now, if you look at that particular chart, it tells you where the pandemic is. The other important thing to understand is how our countries position in terms of responding to the pandemic, in terms of preparedness. Are they prepared? Are they doing enough detection and reporting? And that means testing. How is the response to healthcare of people who are getting sick, isolating those who are sick and quarantining those who have been exposed? How is the health system dealing with both the COVID and the non-COVID cases? Because healthcare should continue. And how are we in compliance with international health regulations? Now, to understand better, let me introduce an academic framework. To understand disaster and risk, and also in crisis, we have come up with an equation here so that the student will be in a better position to appreciate in what areas can we manipulate these factors in order to reduce the risk. Risk is explained as the probability of loss, injury, death, and other consequence, and it's in fact a product of the following variable: hazard. The hazard could be a virus, could be a flash flood, could be volcanic eruption, could be earthquake, could be a building collapsing. That's a hazard. Vulnerability means how are we prepared to deal with it? Are we resilient or less resilient to deal with? Are we trained? Are we prepared? Exposure means the chance of getting exposed. So for instance, you may have landslide in a particular area, but your community is not at the bottom of that hill or far away, so there is lesser risk of exposure. So the risk is therefore lower. Capacity simply means the ability to be able to respond. when there is a disaster that has been created. Let me take you through. In fact, we have a way of managing this risk. Take a look at the next slide. In terms of risk reduction in disaster, you could, in fact, make that black dot smaller. If you come to look at it, hazard, exposure, vulnerability placed together will intersect and create what is known as a potential loss called disaster risk. But we, as citizens of a country, can play a large role, government as well, private sector, can play a large role in reducing the circles of this three interplay and factors by decreasing the hazard, by such as early monitoring of the virus, where they are, where are the clusters, decreasing the exposure, say for instance, by the use of protective equipments, goggles, and face masks. Vulnerability can be reduced through preparedness, engineering, and even insurance. And in application of here, business continuity, planning of enterprise, if they are prepared to bounce back, know what to do, for instance, when there is a threat, are in a better position to be in competition. If you look at it, these are not just the government's 6 lines of defense. In fact, come to think about it, if you are dealing with a pandemic and a virus, there are many things that the government can put in place, but the government's lines of defense is of no value if citizens do not cooperate and business sector do not also collaborate. So government can impose a travel policy ban, restriction, for instance. Once the traveler comes to the border of a country, quarantine measures are undertaken by the Department of Health. If those who are exposed, we know where they are. Contact tracing and surveillance is another important part of these lines of defense. Now, very importantly, if you take a look at the bottom of the slide, there is what I call the importance and critical role a primary healthcare service is. Because you don't want to overload the hospital facilities and services, the primary healthcare, the community practitioners, the family doctor do play a role in early detection and in a referral system. Funeral homes is another way of dealing with this pandemic. For those who are exposed, there are standard operating procedures how to deal with the dead person, the cadaver, for instance. Now, I'd like to share a little bit of technical knowledge here. People sometimes confuse and interchange the term quarantine from isolation. Isolation simply means a person who has been diagnosed and we know for a fact harbors and carries the infection and is contagious. They are isolated. They are segregated from the rest of the normal people. Quarantine, however, refers to people who may be potentially exposed, that we have to segregate in order to observe whether they are developing that infection or not. Now, one way where we play a role in protection is that the citizens, people in a country, in a community, will have to play a role in following quarantine rules in the community, as well as wearing a mask when it is indicated. And these simple things like hygiene, hand washing, physical distancing are all part of an armamentarium of our weapon, where we can then protect ourselves, including our family members. What are the lessons so far surfacing from this experience that we have all over the world? We see frontline workers, not just in the health sector, the heroism coming out of their sacrifice, that they put themselves on the line in order to manage people responsibly, those with their illness. We have heard from many of our doctors that unfortunately patients out of fear would misinform and not declare their history of travel, exposure with other people. And this bit of information is very important for us to do our self-protection. And we advise people who may have been exposed to declare it so that they would not cause further infectivity of other people. We also saw that the business sector, civil society, out of necessity, are now creating innovations. Homemade face masks, personal protective equipment, tents that are created outside of, say, a hospital facility, minimize the interaction of these people in a crowded environment. We see quite a number of private sector all coming forward with their bayanihan spirit, coming to the rescue, contributing to the effort of the government in decreasing further infection. But very importantly, government cannot create trust through social media alone. This credibility must be created through transparency and accountability long before any crisis hits. And this is an important lesson that we're learning right now. Come to think about it, in other countries with strong healthcare institutions, they're able to deal with contact tracing, primary healthcare much better. And luckily in our country, we have now a law called the universal healthcare. But this universal healthcare has to come into implementation. There should be adequate financing, integration of primary and hospital care. National and local government should be integrated in terms of the healthcare system. We still have a long way to go, but this is a wake-up call for us to invest in universal healthcare during this pandemic and beyond this. No? Now, I'm sure many of you listening in this lecture aspire to be either to lead, no, as a crisis leader. Now, there are 7 C's that I would like to recommend to you to learn from, and they're very simple techniques. No, would be that you're a government leader, business leader, or a civic leader. These are leadership techniques that can be simplified for you to apply and adopt. And these 7 C's, I'll share with you a little later. No? One of the things that we found out during this period of pandemic is a proliferation of fake news. Disinformation, misinformation still abounds. And for the likes of us, we really cannot understand why some people would purposely, or out of the, not realizing it, has been passing message to their different social media groups, alluding to news that are sensational, controversial, and yet are not true. Now, if you have been receiving information from your friends, even though they are trusted people with stature, you still have to validate whether that information you're getting is correct or not. How do you know this information is true and correct? How do you assure yourself that you're not in fact being misled? Not every information, even from a news agency, is correct, especially nowadays that our media is not even bothering to check the countervailing information in order to create a balanced information. Some of them are in fact opinions, not even validated as truthful facts. How do you know that you've gotten enough information? Infodemic is one of the terms that has arisen in this pandemic, where you have information overload and that you cannot be able to choose now which one that can you believe or not. In fact, let me ask you some questions. How do you get information? What ethical issues involved in terms of passing information that you did not even bother to read or check is true, if it is true or not? Now, this is a particular warning to people of stature. People, you have a good reputation and credibility, you get an information, you don't even bother to check, you then pass it on to other people. That will also destroy your reputation if eventually that information is not true. So we do have an obligation to report back information that are fake, because this can harm the community through creation of anxiety and panic. Now, another way of looking at dealing with misinformation is a little technique I want to share with you. Ordinary people will look at just the event that you pick up in the news, you read in the newspaper, or a news item in the social media. What I think the important question you should be asking when you see an event, so that you are not misled, fooled, would be to ask what happened, what really happened, what's the story behind this, so that your action would be either to react or to respond. But more than that, we want to teach our students in disaster, as a disaster executive, a practitioner, and a manager for crisis, to look beyond the event and look deeper, look for the pattern, look for the trend. The question you should be asking, what's really been happening? Is there a pattern? Is it a trend? And so that your action perspective would be to be able to anticipate, to plan, and to prepare for it. Not many people go beyond the event to go into the pattern, and that's a shame. In our program, we teach our students again and again how to look deeper and deeper so that we are not misled, because information that you have that is wrong becomes an enemy. You cannot make your proper management plan if you're in your strategy, if you're misled by information. So this is a great problem. But beyond the pattern, some of our students can in fact go deeper and look at the structure. What's really been happening behind that pattern? Is there something in society in terms of regulation, rule, or mental models, in fact, creating that pattern? So what would explain that pattern is that question, and your action perspective would be to design a better policy or rule, to create innovations, and to transform your organization so that the pattern can be stopped. And therefore, if you stop that pattern, the bad event will not happen. So these are some of the strategic steps that we bring into our education in disaster classes. Now, let's take a break now for some question and answer. Do you have some question and answers? Questions that you want to pose? I guess you could put it in the commentary. You know? So can I ask if the information is in fact being screen is shared? Is the screen shared? Sorry. Okay. Now, okay. After this, now we can go to the next slide, please. Okay. Very importantly, people have to understand that this pandemic has led us to some consequences and bad effects. No, so in a way, you can see that the world is temporarily on close. If we go to the next slide, please. Can we go to the next slide? Yes, these widespread pandemics cause a number of bad effects socially and economically. We understand that in global recession, many of our overseas workers may be coming home. There will be decrease in remittance of billions of pesos coming to the country. Not only that, there are travel restrictions, there are isolation of family and individuals. Government has put in a lot of restrictions, like in the community quarantine that we have right now. Infrastructure and business disruptions are there. People have died. Some are ill and are waiting for them to know what the status they have. There are also waves of misinformation. And this has created some form of anxiety and panic. And this is the things that we know of in terms of the effects of pandemic. Next slide, please. Now, earlier, I mentioned that the crisis leaders should understand the 7 Cs. No? So I'm going to share with you the 7 Cs. No? The leader who is responding to a particular crisis must possess calm. They must have grace under pressure, so they are not easily rattled. In this kind of abnormal times, we are looking up to a leader who is not panicky, but also demonstrates some level of confidence. The person, he should be learned, studied, and if he doesn't have all the information, is one who is willing to ask people to guide him and help him so that he gains the confidence in crafting the strategic policies and management tools to deal with that crisis. Very importantly, in this kind of crisis, we also remind our disaster executive not to forget the importance of communication. Many people in the company or in your society or in your institution are hungry for proper information, and this communication will allay their anxiety and fear. Very importantly, collaboration is important because we are not in possession of all the information. The collaboration that we are seeking for is alignment between science, policymaker, management experts, and the community so that they could work together to solve this problem. This pandemic is not going to be a government effort alone. It's a whole of nation approach. And therefore, we have to build communities in this collaboration, community that builds on trust. Now, because people are afraid and they're not resilient, they don't know what's really happening, a little bit of compassion helps. So the crisis leader sometimes can be authoritarian, but he has to learn how to balance compassion with the decision that he's making. Many companies still continue paying the salary of their staffers and employee. Is one form of a human resource a policy dealing with compassion. And it's in crisis here, very importantly, we must possess some level of cash. Your credit may not be very good at this point in time. People have to use this amount of money to be able to keep going. And we learned that from the small, medium enterprise, the food suppliers, the agricultural cooperatives, in order to continue providing fresh produce and supplies. Cash is a very important part of the holding on to cash is a very important part of the economics of management of crisis. Next slide, please. Right. I'd like you to take into consideration something very difficult that I'm not sure the community might not be fully cognizant and aware of this problem. This picture is a picture of a film from years ago. It's called Abandoned Ship. We use this film as a case study for a disaster and crisis leader to understand the role of ethics, the role of making difficult choices, and balancing risk and benefit. The story revolves around 27 people who were victims of a ship that sunk, and they're all wanting to fit into a life raft that can only accommodate 9 people. I bring this very powerful picture into the conversation because if we do not follow quarantine procedures and say flatten the curve, it will overwhelm our medical facilities. Our healthcare capacity is going to be overtaken, and there will be many people who will seek hospitalization, and we don't have enough ventilators. To date, we have 1,500 estimated ventilators or respirators spread out in hospitals across the country. Can you imagine that many of our sick COVID patients will now need a respirator, but not all of them will have the respirator? Now, if you were a crisis leader, how are you going to manage this ethical dilemma? No really clear answers to this. It's very difficult, but then that's why we encourage everybody to help flatten the curve, get involved with quarantine and physical distancing in order for us to be able to manage the really difficult cases of pneumonia and cytokine storms in those patients. So in other countries in Europe, we know that difficult decisions have to be made on who access these ventilators and who are denied of it. Next slide, please. So very importantly, we now go into exit strategy and what happens during recovery and in this extended and enhanced community quarantine. There are many people wanting to know how it would look like. And as we have been saying in the past, this is not going to be normality like what business as usual of what we know. There are many changes in the way we behave socially, in how business will recover. And I would like to show you the next slide and in discussing this way forward. We must learn from other countries. There are countries in Asia, our neighboring countries, that are in fact doing some form of best practices. One example is in Taiwan. We learned that because of their strong healthcare system, universal healthcare, they didn't even have to order a lockdown. In countries like South Korea, they were investing so much in testing in order to identify those who are at risk. Those people who are next slide, please. When they are at risk, they will be able to quarantine them and isolate them appropriately so that you decrease further infection. In other places where credibility and transparency and accountability is important, the constant communication, allaying the fears, and telling our society what exactly is happening, who is doing what, and the coordinated action of different government agency is a very important tool that we learned that in Singapore and Vietnam, they are doing very well. So we must learn from best practices of other countries and adapt appropriately. Next slide, please. For the business leaders in the audience, I'd like to share with you that business continuity planning is an important part of your business standard operating procedure. Who would have thought that this pandemic would have affected us so badly? In fact, as early as SARS days in 2003, and the A and H1N1 epidemic that we had in the late 2000, these were early warning signals for the business to invest in a pandemic plan. However, not many business took to heart and prepared for their plan in case these things happen. And yet, during those times, the US CDC and many other organizations have come up with templates and guidelines to appropriately provide some principles of best practice to allow business to operate in this kind of pandemic times. But it's not too late. I think we should still encourage enterprise, small business, big business to learn how to integrate their SOP, human resource policy, finance policy, legal obligations, dealing with supplier, maintaining customer loyalty and branding are all part of the disaster executive armamentarium. They need to know this in order to advise companies on what to do. And this is really our value added to learning disaster management. Next slide, please. Now, the key message that I'd like to impart to you at the end of this talk is that there is the value in terms of innovations and resilience. These two important key messages and principles is why we are trying to develop the kind of disaster executives. I bet that from now on, people, society, business leaders, government agencies are all going to look for professionals with a background of disaster and risk and management. How do you identify risks? How do you manage these risks? How do you create resilience through innovation, design thinking, social marketing, bridging leadership, are all part of the key messages of why we need to invest in this kind of executives now, because we're not just going to see this pandemic as just one form of disaster. There will be natural disaster. There's still earthquake, there's still going to be flooding, there's still going to be typhoons and different calamities. How are we going to prepare our business, our society to be resilient is really the name of the game. And this is what we can offer you in AIM. So if I move on to the next slide, I think this is probably my last slide, where we could then park the conversation into some form of open forum where we could address your concerns and comments.
Hello, Prof. We sent you the questions from the audience through the Viber group chat, Prof.
Right. I'm going to look at it now and then see how I could comment on this. I'm sorry, the first part of the talk, the shared screen slide was off. The first question that we have here, are the efforts of the government to fight fake news enough? No, they're not enough. What can you say about the disaster response of Pasig Mayor? I have really no comments. I think he's doing a fine job in terms of coordinating the needs of his community. He is a local government executive, and I think he's really aligning now with the national effort, with the guidelines that have been imposed. Do you think that there's going to be a big help if total lockdown is implemented, that as in everything is closed for 2 weeks? I'm afraid 2 weeks may not really be enough. I think that's what science is still telling us. We may have to lock down intensively, really, because we have to prepare for a second wave. Remember in Singapore, where they had some form of modified lockdown initially, now they have to have a more strict lockdown at the moment because they're experiencing some form of second wave. And this could be as a result of travelers coming in, bringing the virus in. And I guess we are learning from that lesson. And of course, there are talks that the strain of the coronavirus can also change. And once it mutates, there might be a different kind of infection that we're seeing, that we could see. In terms of Palakasan Bakar system, what is happening right now, I'm not too sure. This is really about local government efforts in dealing with their own. I know this is not easy. No, local government executives are dealing with something unprecedented. They're also learning from how to deal with it. I guess you could see some level of inequity in the way they deal with some of the response on the ground. I think we have to give them a little bit more time. What is important is that they're willing to listen. They're willing to share information how they manage it, how they did it wrong, so that they could calibrate and iterate and make it better for helping each other. I don't think the local government should work in silos. And because of that, we see problems of perception. I think business leaders and civic leaders are trying their best to advise and help local government. I know for a fact that our healthcare sector, there are professional organizations opening a pathway to help local government and advise them on what to do. Some mayors are listening, in fact. There is a large role for artificial intelligence in dealing with this pandemic. A number of scientific articles, in fact, are coming out now where they can do mathematical modeling and predict where the next wave will be, how bad it will be. And artificial intelligence have been also mentioned in a way to shorten the period of time to do vaccine development and testing. I'm not too clear about how they're going to do it. I'm not a data scientist, but in AIM we do have a group of data scientists looking into this, and they're rock stars in the field of data science. Okay, there's a very relevant question about considering some leading media networks are providing fake news, unverified news, and this is really a shame. No, I guess the media outfit must have better professionals looking at the news, validating it, go deeper, look at the pattern, look at the structure, and then have countervailing information to give balanced news. I think what confuses our society is that sometimes they're listening to a news, and in fact, it's an opinion and editorialized news, not really news. But I think what's more important at this time is I advise our society to just listen to the government channel and what the government is announcing, so that you get the correct perspective. Because otherwise, you have very conflicting news, and this time of crisis, we advise better one set of news that everybody's listening to and calibrating their response rather than different divergent opinions. The other website we recommend is looking at World Health Organization website, and that might be an important scientific body of information. In fact, in the World Health Organization website, they have a section there that is the section that debunks different kinds of fake news and false advice, including what therapies should not be used. No? They have that. If we resume work after this enhanced community quarantine, are there some reference that we can source or pattern our safety and health protocol? No, we don't. This is, as I said, very new, novel, and unprecedented. These things will be something that is evolving right now. If you have good suggestions, please share them with the health professional organizations, because I know that they are crafting something to advise our government and business sector on what to do afterwards. In fact, one of the things that I was recommending is many of the buildings, if you work in say in a building in a corporate setting where your air conditioner might be centralized, as you enter the building, it's going to be very moldy. There might be fungal infection and spores waiting to happen. You might be inhaling spores. So it might, before one goes back to resumption of work in your physical environment, to have some groups make sure that there's occupational safety by cleaning the environment and the air ducts properly before you go in, so that it avoids a secondary form of infection. Now, strategies which schools could jumpstart their learning continuity plan for the duration of the year. We know that many schools overseas, and we're also doing that in Asian Institute of Management, we are continuing our education with the use of online platforms. These online platforms can either be a synchronous continuous learning, where the teacher and the students are physically distant, but yet they're all coming together in the same class for the time being. We are also piloting the alternative learning modality called asynchronous method, where an assignment for a workshop is then shared to the students to work on, and then they come back to meet in order to produce an output. So that's called the asynchronous methodology. I guess many of these online platforms will be heavily dependent on our previous investment on internet. How strong is our internet, the signal, how consistent it is, and I guess we have been told that our internet system in the Philippines sucks. It's not really good, and that's why in many academic institutions, many of the students, in fact, could not continue their online education because the internet system in our country really pales in comparison to other Southeast Asian countries. And really, this is an indictment of a poor investment in the past. So we're not really prepared for this kind of pandemics, unfortunately. Um, what can I say about the handling of our government in this crisis? It's not a perfect system. The government is learning from it. I wish there was more openness and transparency in what they're doing in terms of alignment of different agencies, and they come forward to tell us what they're doing. That would be helpful to the society to understand the value of each of these organizations working collaboratively. But I think they are doing the best that they can in this crisis mode. They're also learning from it. If you have good suggestions, I think we could pass it on to them so that they could improve the way they do things. Um, I think I tried to answer as much. Did government leaders downplay COVID-19 at the very start? Okay, this is going to be a difficult, complicated question to answer. I don't think they, well, when I was reading the patterns, I don't believe the government leaders downplayed. It's just that I don't think they were monitoring enough to find out that this could have been, they did not consider a worst case scenario as a simple answer. And that's why they were not fully prepared for it. If one was doing epidemiologic surveillance locally and also looking at it from abroad, then they would have picked it up. No, I think in late part of January, if you recall, it took almost for 2 days for the World Health Organization to even debate and discuss it very carefully before they declared that this problem was a uh, um, public health importance, uh, public health emergency of international concern. That's the word, PHEIC. That not even a pandemic yet, towards the end of January. So I think they were basing on the capacity of government monitoring it and reporting it so that they could make their informed judgment, without which they would then be unduly alarming the society. You recall that in late 2000, the avian flu influenza was a form of a pandemic, but the World Health Organization, when they announced it, and then it fizzles out, it stopped. It died down very quickly, and the World Health Organization was in fact heavily criticized for the boy that cried wolf. But it's really an unfair statement because I think the World Health Organization at the time knew what was happening, and they were preparing countries, their member countries, on how to deal with it. It's just that the nature of the virus sort of burnout, and in fact that was good. And because of this, people then think that, I think the World Health was labeled inappropriately, unfairly as alarmist. So they were now very careful in terms of calibrating their judgment before they announce it. But once the numbers reach a certain proportion and there were local transmission in different countries around the world, that's the definition of the pandemic then came in. But this is really a wake-up call for countries all over the world to invest in their healthcare system. that they should not take this for granted. By strengthening the healthcare system from the very beginning, we would then be able to deal with unforeseen events. And I think it's also the right thing to do, right? More questions? Are we expecting a longer or extension of the lockdown or quarantine? I think the government has a set of criteria looking at the doubling of cases over a number of days, say every 2 days, how many cases are being reported. But mind you, this reporting of cases is also dependent upon the efficiency of laboratory reports. No? So I think that's one. And how have we reached a peak or not? And have we plateaued? Those are the kind of information I think a government agency would need before they could seriously consider a modified or calibrated lifting of restrictions. So it's not going to be just one consideration. There are also considerations like the ability for uh, equitably rather distributing finance resources and food resources, and if the needs for the economic health has to be taken into consideration as well. So these are ongoing discussion and debates among the policymakers. So there's some form of check and balance, but this has to be guided by evidence and science. And so I guess it does takes time. No? At the end of the day, it's really about risk-benefit consideration. So I really don't know if this extension will go on, but it will be dependent on a number of factors. Now, there's a talk about that this might be a conspiracy, like a bioweapon, that this virus was human engineered. To date, there's really no evidence to say that. Of course, people would believe what they want to believe. As I said, there's no evidence to say that this is a bioweapon. But even if this was a bioweapon, the management would still be the same. No? You treat it like a bio threat, like a pandemic, and the management is still the same. It will take some time for the vaccine to be developed. The projection of international organization and industry is somewhere between 12 months to 18 months, because this really has to be tested for efficacy and also for safety. Um, what would be the significance of work from home strategy as an alternative work arrangement? I think this is a good idea to have work for home for people who do not need to be physically present. That might, in the future, the new normal of our country might be people who can do their work properly from home and be monitored, need not have to compete in for public transportation, going to work, and that might create a better situation and manage our traffic problems that we see day to day before the pandemic struck us. Are there mechanisms for private sector to help indigents without going through LGU to prevent selective distribution? I guess yes, you can do that, but I thought that approaching this from transparency, whole of government, whole of community approach might be much better. In fact, the government came up with Administrative Order 27, which calls for the Office of Civil Defense to create a platform to bridge donors and donees together. If I understand that administrative order, it's not really to for government to control the distribution, but to have a mapping of who has been given some assistance, so that there's no redundancy and duplication, so that people who need most will then be helped. It's a tracking mechanism, I believe, no, but I still have to see that happen. But I think the intention and the spirit of it is there. Should the country industry focus on self-sufficiency, particularly in food security? Definitely, yes. I think this is the battle cry now of the Department of Agriculture, even from the very beginning, that we must be food secure so that we don't have to rely on foreign importation. But food security is not just in the production side, mind you. If you look at the supply chain, the value supply chain of how food is delivered from farm to your table, there are many steps along the way. How they go through the checkpoints, the trucking companies, the logistics company, how it goes to the middleman, how it goes to the retail shop. As you can see, as of the moment, we are seeing that many of the middlemen is taken out of the equation, where the food coming from the cooperatives and from the farm are going directly to villages, where then they are able to package acquisition of food supply without going to the conventional shops. This might be the new normal. I don't know. But we also hear that sometimes along the checkpoints, there are some incongruity about the interpretation of who can go through and who cannot go through. And those were the things that we experienced and saw much earlier during the pandemic time. No? Tapping health professionals outside of medical professionals to practice manpower for COVID response. Yes, I think that's a good idea because not everything can be undertaken by the health professionals. There are sets of work in the hospital that would need volunteers that are not non-medical. And I'm sure that many of these hospitals who are inundated with these cases would much welcome this. But then they must also be protected so that they are not necessarily infected. Exposed and they get infection, because once you're exposed without the proper protection, you have taken off for 14 days in quarantine. Okay. Right now, I know that there are some testing being undertaken in the community and in some hospital to validate the antibody testing kit. No? I think some of our public may not understand, there are two kinds of testing right now. There's a test that is called RT-PCR, which is a test for antigen, part of the virus. And there's a rapid test kit that can come out with an answer within 15 minutes, whether you have the antibodies suggesting that you were exposed, you built up your antibody, and then you detected it, suggesting that you have this infection. No? So there are two kinds of antibody being tested here, immunoglobulin M and immunoglobulin G. So these are now, depending on where you are, one could determine at what stage of infection you have and would make an informed judgment for policymakers on what to do. I'm reading some more question here. I think there was a comment about the agreement that the best practices from other countries. Yes, and this is where I think we should look at what are not just the health systems of these countries like Singapore, South Korea, Vietnam, and Taiwan. I think we should also look into how they dealt with their decision making in local governance, how they do risk communication, how they tell the public what they're doing, what tests are being undertaken, are all part of important lessons that we can learn. And learning it means that we should be able to take some risk and apply it. I think that's some groups are already doing that. Is competence of a leader assumed during crisis? No. There are leaders that are elected or appointed, but they necessarily are not the kind of leaders that can step up during crisis. Oftentimes, we assume a leader to know about what to do during crisis and disaster, but we find out that this is not always the case. Sometimes somebody who is a subordinate, who has grace under pressure, has been through different difficult situations, can make the kind of decisions that are more resilient. The leader should know when to step back and allow this person to take over. And this is really an important point of humility and in the practice of leadership, allowing these people to step up and do the right thing. And again, leadership is never vested on one person. It's a collective teamwork. So competence is very much important part of the one of the 7 C's that is that we expect to surface during crisis. Now, the leader doesn't have to possess all the scientific information necessary to make a decision, but as long as he knows what he doesn't know and asks the right question from people who know, so that they could come up with a better informed judgment. I think that's the real story we're telling here. That when you come to this kind of training and courses, we don't give you all the answers, but we give you the tools so that you know when to use those tools addressing this kind of problems and crisis. I'd like to end this masterclass now and say thank you to everybody for the kind of questions that you have posted here. And I hope you learned something from us. And watch our space, because we will come up more with this kind of masterclass to help you through different kinds of dilemmas. Back to you now.
All right. Thank you, Prof. And thank you for giving your insightful lecture. We hope to see everyone soon again.